Hi everyone, welcome back to Vital Healing. For those of you that are new to my channel, my name is Dr. Candida Schwartz. I am a naturopathic doctor as well as an intuitive healer. So today we are going to talk about COVID, inflammation, and cardiovascular health. And so I'll give you a lot of different ideas about things that you can do and things that you can take and ways that you can change your diet and your lifestyle, as well as specific products, as well as specific nutrients that you can take that as a naturopath, we have a lot of we just have a lot of education around. So there is a real reason why I'm choosing these specific things for this topic today with my training as a naturopath. Right off the bat though, if you have a lot of chronic illness, are on a lot of medications, or already taking a lot of supplements, please contact your doctor, whether it's your medical doctor, your naturopath, whoever, your nurse practitioner, your osteopath, like whoever your healthcare provider is, your primary care. Consult them before changing or adding any supplements or just making any major changes to your routine before doing it. Talk to them. And another person I really like to consult with, and sometimes they're just such a great resource of information, are pharmacists. Pharmacists have a huge database that know all about the different herbs and supplements that are contraindicated with different medications. So pharmacists, I love them. I chat up mine all the time because he's such a wealth of information, and my pharmacist is so lovely. So, all right. So why are we talking about the heart specifically, the cardiovascular system? New studies, and there's a lot of new data that talks about some of the dangerous sequelae or post-COVID issues. It's sequelae is just kind of a fancy way of saying that. COVID changes the heart muscle tissue. It can add a lot of blood clots. They've done a lot of research with different biopsies of how the heart muscle changed when people had health, compared to a healthy heart muscle tissue and post COVID, with even with cadavers. They've done a lot of testing, and the tissue changes in a really strange way, adding all of this inflammation and blood clotting in the heart. So if you've already got a personal or a family history of cardiovascular issue, you might really want to pay attention to this. But they're finding this in people that had no pre-existing conditions. So I think that this is a really worthwhile conversation to have. Inflammation is always important to talk about, but specifically stuff that is tailored for the heart. Cardio protective, but also cardio reparative, I think can be really important. So this is going to help with systemic inflammation, but also cardiovascular inflammation, and specifically whether you're in the pre-active or post-COVID phase. We don't know what's going to happen this fall, so I think that I think these are some really great things to have on track, or in your daily routine. Okay, so let's start with zinc. Zinc is getting a lot of press. You've probably heard about it, but it is a really great antioxidant, and specifically towards viruses. So I like to do at least 25 milligrams of zinc. You can go up to about 50. If you're on zinc long term, you might want to find a supplement that has zinc with copper, because when you take zinc for a long time, you deplete your copper storage. You only need a little bit of copper in your body, but you do need it. So a 6-to-1 ratio of zinc to copper. So if you have 25 milligrams of zinc, you might want to do about 3 or 4 milligrams of copper, something like that. My favorite, or two, I have a few favorites. So the liposomal products, I don't know, who's heard of those liposomal products? Give me a little comment below, or put a little thumbs up or something. The liposomal products are products that you take and you hold them in your mouth for about 20 to 30 seconds, and you don't have any food or drink for about 20 minutes before and after, and you do them on an empty stomach. And the reason why you want to do these is is because it absorbs immediately in the mouth when you're taking it. It doesn't have to go through the whole digestive process. Um, so you're absorbing more of the nutrients, and then you're also, especially with vitamin C, which is the one that I'm going to talk about the most because it's such a great antioxidant, you're getting so much of that vitamin C, and it's so good for your overall cell health that it doesn't have to go through the digestive process, so you don't get those, a lot of people when they take a lot of vitamin C get diarrhea, and especially if you're prone to diarrhea, vitamin C can be a hard thing. It can be hard on your digestion. And then that being said, the liposomal products increase the absorption, because a lot of times when we have a compromised gut, leaky gut, SIBO, IBS, IBD, parasites, any kind of chronic gut issues, just chronic reflux, chronic GERD, chronic bloating, those are all signs of a compromised gut. So if you bypass the whole potential absorption issue, a lot of people feel that, they take supplements, but if their guts aren't absorbing them, they're not really doing anything for their body. They're just kind of wasting money. So I really love these liposomal products. They have a D that's really great, a C, like I said, they have a B complex, they have all the Bs. So Bs can give you energy. They're great for adrenal health. They can be very calming depending on which B product you get. Really good for your nervous system, really great for metabolism. I always call them the busy bees. They're always kind of working all over your body. Liposomal products, I can't tell you enough how great they are. Another favorite that I have is NAC, so N-acetylcysteine. So N like Nancy, A like Apple, C like Charlie, or Candida. So NAC is so great for inflammation, for detoxification. It's really great for anything upper respiratory, so anything heart, lungs, chronic sinus issues, chronic ear infections, allergies, cold sores. It's used a lot with Lyme patients here in Maine. I give it to my SIBO people. I just love NAC, and it's really relatively safe. And you can take up to 1,200 milligrams 3 times a day, and it's still pretty safe. They give NAC for when, like, to people in the hospital for when they have like an aspirin overdose. So it's really pretty safe even at high doses. So if you're a post-COVID person and you're still having tightening in your chest, take NAC. Start with 600 milligrams a day, and if it does the trick, great. If it doesn't do it, then do it until your symptoms have calmed down a little bit. Your chest feels a little bit more open, your sinuses have drained, your allergies are calmed down, your joints feel better, right? Okay, and then vitamin D, the liposomal, I think is great. I do really like vitamin D with K2. It's a specific product. K2 is really good for cardiovascular issues, and it's a great clot buster. Like, it helps break down those clots. So again, if you're on warfarin, you don't want to take K2, but it can be really great, especially if you're seeing those post-COVID issues around, the clotting in the tissue and just that inflammation. And then vitamin D, we know, is just so cardioprotective and so good for your overall immune system, your gut health, your brain activity, depression, anxiety. Vitamin D is just so great. CoQ10 is one of my favorite for anything brain, but anything cardiovascular. I love CoQ10. In so many different countries, they use them in really high doses. It really, it reverses heart damage, like cardiovascular damage. CoQ10 is incredible. Fish oil, you can eat your omega-3s, nuts, seeds, chia, hemp, flax. You can have, salmon, sardines, mackerel. I just like to, I'll put the link for everything, but like the link for the Seafood Watch for your area, just to get sustainable seafood. And then also, low heavy metals with your seafood. So I'll put that link below, but I do like to check that when I go out to the fish market, just to see like what's sustainable as well as low in toxicity with my fish. Green leafy vegetables are really high in the omega-3s, you know, chia flax, all of those, all of those. So there's that. Or you can take fish oil. It's you know, I would probably start with 2 grams a day. You know, I think it could be really great for anti-inflammation throughout your body. Really good for heart health. Blah blah blah. Right? I've already talked about all that. Another thing that I really love is frankincense. Frankincense as an oil. I like to rub it on my chest and on my throat. You know, your thymus is right around here. Your thyroid, you know, you kind of swallow, it's right around here. You've got your butterfly wings right in through here. Especially if you have like autoimmune issues, specifically like Hashimoto's. Frankincense, there are lots of studies for those people that are post-COVID, whether they're kids or adults, those multi-system inflammation that we're seeing with people post-COVID. So you can do it topically, but then I'm going to give a couple of supplements that have a higher dose of the resin that can be really great. Frankincense is just a great antiviral. It's very calming. So that's why I like to also do it topically. I like to smell it. It can be very grounding. It can be very calming. So you can kind of boost your immune system topically and, you know, put it on your chest and kind of open up, you know, kind of calm the heart down, get a little grounded. That can be really helpful for your cortisol production, which causes inflammation, you know, just that whole cycle. So anything that you can do that's really calming. So frankincense is great. Turmeric gets so much press. Ginger gets so much press. Great anti-inflammatories, but you need them in higher doses if you really are struggling with inflammation. So to the supplements that I wanted to talk about, Endo Inflame is using herbs and nutrients to kind of trigger the endocannabinoid system. This lowers inflammation, really great for achy joints, just inflammation in general. This company has all these different phytoendocannabinoids. So what that means is that you're using herbs to trigger that endocannabinoid system. So you're not, you know, so if you're not taking CBD, this is a nice way to go. This is a milder of the 2 supplements I'm going to recommend. It's got the frankincense, it's got the turmeric, the ginger, it's got white peony, which is great for pain, magnolia, which is really calming and soothing, and magnolia is really good for the heart too. Echinacea, just a really great product. I love this whole line of, they've got Endo Bliss, they've got Endo Sleep. I think it's a really great line of, and I don't endorse anything. I just really like the product. Inflame X is higher dose. You're going to get your higher doses of frankincense and turmeric. It's got white willow, which is kind of our version of, as naturopaths, it's our kind of natural aspirin. Bromelain. Yeah, the frankincense, it's, you know, reversing that cardiovascular damage. Yeah, just so good. So those are 2. The Endo Inflame is a little bit more gentle. You know, the amounts aren't as high. Inflame X is more kind of going for it. So again, talk to your doctor. And then selenium is, I'd love to talk about diet right now. 3 Brazil nuts a day, 2 to 3 Brazil nuts a day, you get your amount of selenium. Selenium is an incredible antioxidant. So, and you're getting some protein, you're getting fiber, you're getting all of the minerals and vitamin E that you get with nuts in general. Remember we talked about fish oil and omega-3s, right? So 2 to 3 Brazil nuts a day, enjoy. And let's see. Bone broth, I think, can be really great. If you make your own bone broth, make sure you add a whole bunch of onion skins because they're your highest amount of quercetin, which is a great anti-inflammatory that you can get in your diet. So if you're making your own bone broth, there are lots of recipes out there. Just make sure you add a bunch of onion skins. Save your onion skins, wash them, and then dry them and put them in the freezer until you're going to make your bone broth. That's really great. And bone broth is so good for so many different things, that collagen. It's just so good for so many different parts of your body. But it's a great anti-inflammatory, and it's very reparative to like the gut lining, which carries so much of your immune system. Let's see, what else can I talk to you about? I think a paleo diet can be really great. I think a keto diet can be great, although a keto diet, I think you should really talk to your doctor about that and be monitored, especially if you're, overweight and, you have blood pressure issues and cholesterol issues. If you've got, when I think of keto, I think of, kids with epilepsy. I think of Alzheimer's. I think of Parkinson's. I think of all of those neurological issues, ADHD, autism. I do think of people that are obese with cardiovascular issues. I just think that those people need to be a little bit more careful and be monitored. I think everybody should be monitored on a keto diet with blood work. And I think of cancer patients for keto. But paleo is reasonable, and if you do need some grain, I think just whole grains, amaranth, quinoa. That's actually a seed, but it can kind of feel like a grain. What brown rice, the forbidden rice, the black rice, full of antioxidants. Let's see, millet, amaranth, quinoa, like those are really great grains. Just do a quarter of your plate of grains and then a quarter of a plate of organic meats that are grass-fed and hormone-free. You don't need a 10-ounce steak. You can get your protein in 4 or 5 ounces, especially if you want to go more towards that balanced diet. But half of your plate should be colorful fruits, colorful vegetables. Cardiovascular health, blueberries, onions, garlic, those are all really great foods to incorporate for cardiovascular health. Celery, 4 stalks of celery a day can lower your blood pressure naturally. With a little almond butter, delicious, a delicious snack. Really great diuretic. Melatonin. A lot of studies with melatonin and COVID. If you actually have active or post-COVID, you can go into the higher, like 10 to 20 milligrams a day of melatonin at those doses. It's actually anti-carcinogenic, as well as it's a really strong antioxidant at those doses. So if you're preventing, you could do the lower doses. If you have trouble sleeping, try some of the higher doses. If you get really wacky, unsettling dreams, or you wake up feeling really stoned and out of it, then maybe melatonin's not your thing. But it's certainly something worth mentioning because there are a lot of studies around that. And then lastly, anything that you can do to calm your nervous system, calm your adrenals. When we're in this constant like fight or flight mode, constant stress, constant anxiety, constant, just worry and fear, that is going to pump out cortisol. Cortisol is going to naturally increase the inflammation in your body. So daily meditation and long walks, not walks where you're on your phone. I'm saying like walks where you're, swinging your arms and doing that kind of bilateral with your legs and your arms, where you're, walking like this, can really just like process a lot of your day, process a lot of your feelings, kind of just get that stress out. Exercise is so good for getting that stress out, getting the anxiety down, just really calming your body down and releasing those natural endorphins. But if you're tired, just going for a 20-minute walk around the block to clear your head can be great. Meditation. I like coloring books. I like making my jewelry. Any of those creative outlets. I like to cook. Anything that just takes you out of the COVID crisis and the pandemic pandemonium and give you a better perspective around your own personal life and where you're heading can be really great. I will attach a link to this really great meditation for your DNA and your heart. Once you watch the video, you can do the meditation really quickly. You can do that day and night. You know, and I have so many different resources on this channel, and there's so many different resources out there of different ways to calm your adrenals and calm your nervous system and kind of give you a more like a different perception or a bit different perspective, or like a different lens to kind of approach what's happening in our nation and what's happening in our own personal communities and lives and what's happening globally, because it's not just the pandemic that we're fighting at this point. You know, we are a nation in the United States that is very, very split, and with this upcoming election and all of these different you know, Black Lives Matter and Me Too movement, and you know, all of these different things that are coming up. God, it's really stressful. It's really, really stressful. So anything that you can do to take care of yourself. I'll put some links to some videos I've done. I'll be doing more videos. I do every Thursday at the very least. But yeah, so I'm going to just leave it at that. And hopefully that's some really good information that you can start incorporating. Talk to your pharmacist, talk to your doctor, and check out my links below, and comment, like, share, subscribe, turn on the notification bell. It really supports the channel. It's very appreciated. And lastly, comment below on, you know, different ideas about what are some different videos that you want some information around with the energy medicine, the naturopathy, nature cure, different demos, recipes. I have so many different things that I can offer. So be well, stay safe, breathe, be calm, hydrate, take really good care of yourself, do something really special for yourself every day that nourishes you, that that just really centers you and helps you with your perspective as you move through your days. All right, thanks so much. Have a great day. We'll see you next time.